Welcome everyone to our session today with our visiting scholar. Ms. Bryant is here today from Aotearoa, or as what we may know it as New Zealand, and has been with us actually for a few weeks. She has been a practicing physiotherapist since 1994 and is very interested in incorporating and has been working to incorporate original Maori perspectives and Maori rehabilitation techniques into modern day treatments. She is driven to address equity for Maori accessing relevant and engaging rehabilitative and preventative services. Ms. Bryant is the Associate Dean Maori and lecturer at the University of Otago School of Physiotherapy. So, yeah, that's right. Supporting the university's Maori student success, Maori strategic framework, and Kaupapa Maori research. She's also involved in research led out of her tribal entity, Te Runaga Otakawa, and then she has developed an exercise program called Torete 2. It's an exercise program for aging Maori, which was the result of a research conducted out of TRO to develop falls prevention that engages elderly Maori populations. So I welcome Katrina here today, and she's presenting on perspectives of Maori physiotherapists and researchers and positive solutions in physiotherapy. So with that, Katrina, you can take it away.
Oh, tēnā koe, Natalie. Thank you so much. And thank you all. So, tēnā koutou, tanze, bonjour, and hello, bonjour, to all of you out there. So thank you for your time. As I say, I'm just going to present my experiences, and hopefully something will resonate with you in my presentation. So, ko waio, so who am I? Ko Pokekuda te mauka, ko te tai o tākou te awa, ko waitaha ka te māmoe, kaitahu ka iwi, ko Wiremu Pōtiki, tōku tūpuna, ko Katrina Bryant, tōku ekoa. So that is a way that many Māori introduce themselves, by introducing their tribal connection to a mountain, to a waterway, then to our tupuna, our ancestors, and then to the present day. So, nō reira, tēnā koutou katoa. So I am, as Natalie was saying, I'm a physio of 30 years. I was born and bred in Otago, New Zealand. So the photos there, that middle photo on the top, that is my tribal whenua or land, te runanga o Ōtākau. So I'm very honoured and privileged to also work for my runanga. I am also at Ōtākau Whakaihu Waka, which is Otago University. I've been there for 16 years, which is also where I trained. As a physiotherapist. So it's fantastic to be able to do the work that I do. I just feel so privileged. The other photos on the top there is my father and my daughter. So I apologize if you've seen my presentations. This is my introduction slide. That's my father and my daughter, Ariana, who've just joined us, joined me here in Manitoba, my partner and my daughter, Ariana, who's now 10. Then to the right there, that's my great-great-great-grandfather, Wiremu Pōtiki, who is a rangatira or a grand chief of the area, and I'll talk a little more about him as well. So as Natalie says, I have a grand interest in supporting things Māori, moving into the forefront of our modern day practice here in Aotearoa, New Zealand, and I'm really interested to see what people are doing here in terms of Indigenous movement patterns and bringing rehabilitation into the communities. So I do want to acknowledge, of course, the Indigenous people of this place. So I've had so much pleasure in meeting people in the communities of Seguin. They very much looked after me. And the elders here at the Ngomazin Centre, Charlotte, George, and Elder Margaret, just absolutely lovely. So I wanted to ask them, because I'm not here to indigenize any programs. I just want to make sure that I'm not stepping on any toes. I've talked with them and they've said, Katrina, go for it. So I'm glad to do that. Of course, I want to acknowledge the main reason I'm here is the connection with Reg Urbanowski. What a fantastic person. He's doing some great work in the community. We've had a connection online. I'm like, I'd love to come over, Reg. And so he's been working with Jackie and Leanne to facilitate me to come over on the Juliette Cooper visiting scholar. And I had the very beautiful pleasure of meeting Juliette, or Archie, and got that great photo. So as you can see, if you take selfies with me, you'll probably end up in one of my presentations. So just be mindful. So today I just want to overview some of the similarities that we have with Indigenous perspectives that are here in Canada, and that are also very similar to the realities that we have for our people in Aotearoa, New Zealand. And then present my experience, my journeys as an Indigenous physiotherapist, and particularly my work with our community, Tauriti too. I'll hopefully be able to present what that means to you through this presentation. So as I said, Wiremu Pōtiki was a rangatira, a chief. So a rangatira means to serve as a chief, to serve your people, to make connections with your people and network. So he was a great networker, as it transpires. He networked very well with the new settlers at the time. And he did sign one of our treaties, and on his deathbed, he was noted for being very disappointed with the broken promises of schools and hospitals for our people. And so at that time, the promises were, the people were shattered. They were devastated by the lack of reciprocity of for those treaties in Aotearoa. And so this has led to a few generations. It's only been a very short time. I mean, so my great-great-great-grandfather was, he signed the treaty in the 1840s. So it's only been a very short amount of time that this inequitable outcomes for our people has come through the process of colonization. And so this is where we're working. We want to put more juice in the rehab boxes so that we can get at those equitable outcomes. So this is part of my journey in my drive towards this. Now, here's a remarkable woman. Her name is Irihapiti Murchie. And I'm going to name drop her because she also is my partner's grandmother. She was a remarkable woman. She had 10 children. She got her honorary doctorate at Massey University for the work that she did with Māori women and smoking cessation, etc. She was a founder of the Māori Women's Welfare League, which also my great auntie was also. They were friends. and she was a human rights commissioner. She was an actress, but she was a great actor. Well, she was a great advocate for Māori health positioning and positioning our knowledge and science into being valued the same. So this is this is why she also got her honorary doctorate. So she was once presenting in a conference, and she was saying, how do we let our health practitioners understand that for us as Māori, health is much more than just a physical thing. It's an interconnected web of our mental health, our spiritual health, our connectedness to the whenua or the land, and our connections with each other, our relationships or our families, our connections and relationships. How on earth, she said, do we let health practitioners know that we need to have better healthcare that looks at the whole person and the whole realities, including these things? There was a fellow there listening to that conversation, and he thought, wow, what a great concept. He heard her talk about how our idea of well-being is 4 walls of a house, and they're only as sturdy as each one. If one's falling down, the others tend to, but if they're based on good foundations, that is our well-being. Mauri ora, we're in a state of well-being. And Sir Mason Jury, he's a psychiatrist, so he's a medical doctor, he's a psychiatrist, and he heard this conversation, and he designed this model of well-being, which now is very well understood. It's taught in every medical field. You learn te whare tapawha, which is the walls of the house, and that gives this idea of a very strong holistic view of health. So the reason I told you that is because that's my daughter's great-grandmother. So I'm just making sure you understand I'm well connected, aside from being a princess as well. But anyway, te whare tapawha. So here we have the model here of that idea of health and well-being for Māori. And there are many other models that we have that are out there as well, that have been created even further from this idea of the 4 cornerstones of health. That model there that you see on the right, that is actually a model that we've designed out of the School of Physiotherapy. And I'm going to be presenting this to the students on Friday, which I also hope that staff can come to. So this is the model, the Pokare Whakaro model, which is the ripple effect model, which we've used in research. But we teach all of our students as a part of the subjective examination, and how do you get to all of those different areas of well-being. But I'll talk more on Friday about that model. Needless to say that these models of Indigenous well-being are very similar between New Zealand and between Canada. Here I've found a model that that is presented as an Indigenous model of well-being, and very similar ideas. Of course, as I talked to the curriculum committee yesterday, I loved circles, and there you go, the Canadian model is circles. And so there's been there's much literature to show that there are very similar ideas of this collective, holistic concepts of health and well-being for our Indigenous peoples across the world. So when we talk about this collective idea of well-being, this is about the collective well-being of your community rather than the well-being of an individual. So actually focusing on the well-being of the community and your family is a very common perspective in Indigenous well-being. Okay, now moving towards me. So as I said, I've been practicing as a physio for about 30 years. I worked in America for about 10, then came back to Aotearoa, started working at the university. And I also, I have a passion for a movement and analyzing gait and movement and posture. And so I was doing this in for other physiotherapists, and I decided I needed my own space to do the specific movement analysis. I've just been up with Tony in the lab that they do falls prevention and treadmill work, and my head is just exploding with ideas of collaboration. So I love what he's doing, but I'd love to also see how his work can be alongside the Indigenous communities. Anyway, I've got my own practice in Aotearoa, in Dunedin, where I'm from. And I have a very large base of Māori people that come and see me because I'm connected in the community. In that practice, I actually do try to engage, that's me a few years ago and a lot thinner, using some of the Māori techniques into rehabilitation for my patients in the private setting as well. So I've had this great desire to actually design physiotherapy techniques broadly so that a lot of people could get these techniques and apply them so that it is an engaging process to engage our people, Indigenous people, into rehab. Because what we're seeing, and the stories I've been hearing is that actually many Indigenous people are not engaging in our physiotherapy services. And I believe that possibly it's because the things that we offer are not necessarily that engaging for them. So that if we can facilitate bringing our old practices into place, maybe that is more connecting. So that was my theory. I was using it in my own practice, but I wanted to see how to apply that more broadly. So Edward Ellison, who is the chief or the head person at our runanga, he did come to me. He was working for our national, I guess you'd say, insurance agency that pays for physiotherapy treatment, and that's called ACC, Accident Compensation Corporation. So they're a government-funded agency. He was working for them back in the day at that time, as we wear many different hats. He was working there as a Māori advisor for this national organisation. And he heard the kōrero, he heard the discussion that falls was a massive issue for our elderly and specifically for Māori elderly. So I had asked him, Edward, to come and open a big conference that we had to celebrate the 100 years of physiotherapy school in Otago. And so he did come and open, and as he was opening, he tapped me on the shoulder and said, Katrina, what are we doing for elderly and falls? What is physiotherapy doing for elderly, for our Māori elderly kaumātua and falls? Basically telling me, Katrina, what are you going to do? So he was instructing me. That's our leader telling us that. So I had a huge responsibility on my hands. So I did look to get some research funding to see how we could do it. And boy, this is how our program, Tauriti 2, came along. And so we've had the history has been, Edward came to me in the early 2000s. And by the time I'd got my head around how to do this and put in an application and become successful, it was 2017. And then from there, it has just grown and developed exponentially. And I think largely because we've kept it, the question came from the community, from a leader in the community. So, and following through with that has been one of the reasons that it's very successful. So, let me see, I think, yes, so we initially engaged so many people in the community, experts in the community and Māori movement. So that top line, we have experts in Maurako, that's Jade Morgan on the top there. In the middle is my sister, that's Lou Pōtiki Bryant. She's a New Zealand famous, world famous dancer choreographer, and her research has been around traditional movement patterns. And then Georgia Latu, she's a poi expert. She's a young lady who's the CEO of the largest poi company, which is what she's that's the best rehab, as I've said, for the wrists. And she makes those poi. And she knows poi very well. Then we've also had other members in the community who are experts of community engagement. I don't want to go through everybody there, but we're also Margaret Dando, who is a very successful falls program community developer. She's got a program called SAGO, which is throughout Aotearoa as well, and has been developed over 15 years. And then we have many Māori academics also in the falls prevention space. In the far bottom right corner, that's our dean at the University of Otago School of Physiotherapy, and she's a falls risk researcher, as well as Deborah Waters, who's an American who has actually employed at the University of Otago as well. So lots of people were involved, and many, many more, but importantly, our elders in the community and our workers in the community. So we have, through our research, we have employed and educated 100 research assistants in community that are involved in delivering this exercise program, which we've developed, which is a great success because that is building workforce capacity in our communities. It's just been a fantastic process. So our first trial was within our community in Dunedin in Ōtākau. We had 3 venues in that area. We aimed to recruit 30 participants, and we got 50. Says no research ever. And the reason we had such good recruitment, I believe, is that the research was being driven and run out of our runanga, out of our tribal entity, not the university. This money was coming into our tribal entity, and we were engaging with those academics and paying them the petrol vouchers for their engagement. So the money was coming into our tribal entity, which just gave the people in the community so much trust. So that is why we had such a big recruitment, and we over-recruited and for our trial. So our trial, first we had to develop the practice, and that was a lot of testing and a lot of collaboration with those movement workers and falls researchers to develop something that was really effective for falls prevention. We developed a soundtrack and some videos, and we did a 3-month trial. So we did testing of, we used physical testing of falls risks before and after the trial, and we had some success. We did show in 2 of our 3 falls risks that performing weekly exercise program, using this program, was successful in reducing, clinically, it showed the minimal clinical results for reduction of falls risks. And that was in leg strength, so sit to stand, and for our balance testing. So we did 4 points testing. We showed statistical improvements in timed up and go walking, but not clinically. So we acknowledged that we needed to get more walking in our program. Hang on, maybe I've gone a bit too far, because this slide is saying how we did the research. So we made sure that we had the criteria that is acknowledged for evidence-based criterion that were important for having an effective community strength and balance program. There's 9 criterion. I don't want to get into too much depth there, but Tauriti 2, our practice, meets all of those criterion. We did use the validated kaupapa Māori research philosophies, and we involved, of course, importantly, community experts. So here is Moana Wesley. She's our key person in the community, and there she is doing some of our traditional bird foot movements, which of course we've incorporated in the practice and for body awareness. So here we go. It was so successful, we actually did get some other funding after that research from a Māori health funding agency to run in those 3 venues, run Tauriti 2 weekly practice for another year. And we were asked to present at their symposium. The best people to present our kaupapa is our kaumatua, and there they are presenting at the symposium. And so then following that, another RFP came around, request for proposal research funding came up. And this was, again, ACC, as I've talked about, this was our national insurance company realizing that Māori just do not engage with ACC or physiotherapy, and especially for our aging population. And so they put out this request about achieving equitable injury prevention for aging Māori. We thought, was this written for us? We applied for this funding and we kept it with our tribal entity. We were told, no, you won't get the funding because you'll have to do it through the university. But we stuck steady to it, and we were one of the 2 participants that won the funding, opposed to many universities that were trying to get this research money. So we received $900,000 to do a longitudinal study of those 3 groups that have already been doing Tauriti 2 for now a year, and also try it in other areas. So we wanted to see, was Tauriti 2 going to work in other communities around the country? And so we know, falls in New Zealand, a small country of 5 million, falls is the biggest cost for injuries. We know this. ACC keeps this data. Last year, falls for Māori cost $44 million, which is a big, $1 million, which is a big deal for us in New Zealand. So that was a big cost to our community. So we wanted to know how to reduce that. As I say, there's a plethora of evidence out there to say why Māori don't engage or why Indigenous people don't engage. We know that. So sorry, this is just a review of some of their paper. Don't worry about it. The ACC have some very good literature that they already did, so they know what the barriers are. They wanted to find solutions. So as I said, we trained research assistants across these now 6 new organizations throughout the country. We trained them in all of the research processes. So this was a qualitative and quantitative research. So we were looking at false risk for the quantitative. We were also looking at how the experiences of our participants and how they found participating in this exercise program that had largely Māori movement practices. And so we used our tool there to do the qualitative analysis. That we also had false diaries, and we had a questionnaire as well. So we developed a website so that supported the research assistants across the country as well, with videos of all of the exercises, and this was also useful in COVID times, because of course COVID struck, so our kaumātua could do the exercises online if they wanted. Our elderly people don't really like to engage. They want to engage with each other. The community setting is definitely the most effective engaging process. So we again recruited so many more than we were hoping for. We were thinking for to recruit 100 participants. We recruited 150 participants across the country that we're now going to do taurititu on a weekly basis. So for this, we managed to do a 3-month trial again, a full year trial, which was intercepted by COVID. So that was a bit of a bother, but here I've got some videos of some of the groups and 6 groups around the country, 6 communities. Exercises, some of the games, and of course the poi. So we had a lot of people engaging. And our study results. This was so exciting. So we had our, this is the way that I disseminate our research results to the community. I have graphs and everything, but boy, their eyes go blurry when they see graphs. So this is how we present it. They were stronger, so their leg strength was clinically, the minimal clinical difference, statistically significant differences, their balance again, and this time our timed up and go also showed the minimal clinical statistical significant increase. So that's fantastic. So here are 2 of our kaumātua after the 3-month trial. They're younger, more attractive, stronger. No, obviously that's a joke, and hopefully you're all laughing. But they did do better. So that was very encouraging. And of course, our qualitative results also helped support the much broader wellness benefits that our kaumātua got from doing this physiotherapy exercise program that had their movement, and it was driven by their communities. So they did notice themselves that they're stronger, their physical strength was better, their balance was better, their knowledge, their posture awareness was better, and that supported other areas of their health. So not just for falls prevention. And by the way, we don't use falls prevention. That is not a sexy term. Nobody wants to do a falls prevention program. They want to do a strength and balance exercise program, which is always more engaging. So It supported, they were looking at other health benefits, like they were managing their diabetes. They were having cardiovascular improvements. They were more engaged with exercise just in general, and that we even have a pelvic floor exercises. Some of them were finding that they had better control of their pelvic floor, which is just fantastic. You're never too old to improve your pelvic floor. And so, of course, with those broader perspectives, they had a deeper connection. Many of them felt such a connection. They were learning their language. So for many of our elderly, they've lost their connection to our language, Te Reo Māori. But there was with this gentle connection into that. And so that is so empowering to many of our people. So even being connected back to their tribal entities was amazing. So they're often on marae, so that's like a longhouse here. So even being connected into that space on a weekly basis has been so encouraging. The connections. Now, I'm not going, as physios, we want to think, oh, it's the physical things that drives them, but it is the connections. So those relationships with each other, which has positive impacts across the board socially, and of course in the mental health area. So these were so encouraging, much more than we ever anticipated, that this would have such an amazing impact for our people. And really, that just there, we continue to have funding now, and I'll talk more about that, but the feedback that we have from our kaumātua, that's what keeps us going. I'm not going to lie, it's really time consuming, but it's because it is having such amazing impacts for our communities. This is the thing that keeps us driving to press for this to happen. So at this point of time, I'm giving myself a prompt. So I'm hoping that this is going to work, and you will tell me if it doesn't. And here's a bit of a video. I'll put the, here we go. Let's see, have the quality nice. And we will start from the start. Hang on. This is not the start, so we'll start from the start. Hopefully you can hear this. Please let me know if you can't.
All good.
Good, thank you.
Ko te aroha te pau kia mau. Ko te aroha te pau tiri kia u. Kia mau kia u. Te pau o te aroha ki roto i tēnei whare. Ki tēnā o tātou. Whakamaua kia tina. Tina haumie hui e tai ki e. This is our kaupapa, tauriti tū. So tauriti is the balance of things. So obviously to stand. It initiated from our upoko Edward Ellison at Ōtākau, and he was the one who said, Katrina, what are we doing for our elderly and falls?
And the realisation that for Māori and for elderly people, one of the biggest issues is falls. And I just mentioned that to Katrina, and of course that aligned, I think, with her thinking and where she was headed, and I think reinforced her idea to set up something like Tauriti tū.
Really lucky to work at the School of Physiotherapy as well in town. My colleagues there are some world-renowned falls prevention experts.
She started talking about the ideas of how we could develop a program that would be relevant to Māori, helping her think about some of the aspects of falls prevention classes that need to be in place to make sure that the classes do deliver.
There are currently multiple rōpū throughout Aotearoa doing tauriti tū, and the kaupapa continues to grow.
I started this program in September last year, and I've never missed a class, and I cannot believe the difference it's made.
Asked me if I would be interested. I said yes, because I'm having trouble adjusting to retirement age.
When I first come here, I thought that I was like I was when I was 16, and do the limbo and the rock and roll and the twist in them and everything. And when I come here, I couldn't even stand on one foot.
As we get older, like our knees and ankles and hips and whatnot start to not function the way they used to, and we don't realise it.
It's a lot of fun. And it's about learning from one another. Have good balance. That as you get a little bit more mature, you do get a bit wobbly.
Key part of the kaupapa, as I've been talking about, is the whakawhanaukataka element.
Couldn't believe how loving and friendly and kind and safe it was.
There's a warmth here. Photographs of our parents, towers and what they used to do.
You know, we just love getting here once a week and we have a good laugh.
And helping them with like fall prevention and just kind of keeping our people safe.
You can see the physical benefits, so we're getting through the program a lot quicker, which means they're more confident, they're stronger. When we do our testing, we see the results.
The game changer is that I can now do a lot more things that I couldn't do before.
As an expert in physiotherapy, to actually work for our people, I feel like a really strong relationship and responsibility to our Māori. I want to put that taki out to others who are experts in their field, work with whānau, because we need to be answering our own health questions.
There we go. Now, hopefully this is going to work for me. Please work. Let's see. Yes. That's always good. Okay. So that is a video on our kaupapa. So now the one thing I've missed, it is a weekly program, which is an hour of exercises and then an hour of food kai time, call it. So an hour of, it's not lunch, it's afternoon tea, morning tea. So they're usually in the morning. So it's a snack, and that keeps it doable for our kaimahi there. So at that hour of food and socialization time, we also have other professionals come in. So we have dietitians, pharmacists, we have dentists come in and talk about dentures. We've had podiatrists come in. We've had breast cancer checks. We've had multiple levels of services come in and talk to our kaumātua, and that is also a really great process. So whoever's visiting is very clearly told they're not to come in and present to our kaumātua. They're not to tell them how to do and what to eat. Our kaumātua, our elders don't want to be told what to do. They're sick of that. They've had that, and that's not engaging. So what they want is their questions answered. And so that's really engaging for our kaumātua. So then they can feel like their questions will be answered. And so to our visitors, I say, just be careful. Because our kaumātua will ask you some curly questions, but it's very good, and it also gives those services an opportunity to engage with our communities. And if they do a good job, they'll be invited back by the elders. So there's my father. You might have noticed my father on the video. He's one of the participants. So anyway, we wrote up our research after those trials, and we were very, very, very happy with our results, the quantitative and of course the qualitative. So my reports always have so much more around the experiences, because that's so important. We need to make sure that the experiences are important. So the other important data that we did collect was attendance data and retention data. So our attendance, even over COVID and after COVID, was at 80%, and our retention level was at 75%, which is just magic. So that shows to us that our program was engaging and it had longevity. So we don't just want to do a 10-week program. This is a program that we're going, because you don't just get strength and balance in 10 weeks and then go to do it yourself. This is a program that is provided ongoing. And we still have all of our original participants in Otago that have been now coming for 5 years, which is just remarkable and just a wonderful success story for us. These are people that would not necessarily be doing exercise in any other way. I want to tell you a little bit about my father's story, actually, if that's okay. I've got a little bit of time. He was an active man. He was a gymnast in his youth. He was a hurdler, track and field athlete. And then he became an accountant in his life, in his career, and physical activity went off. And he was suffering from sleep apnea, diabetes, and he was getting quite big. He started doing Tōriti too, and it started challenging his balance. And he realized, wow, I'm not as good as I thought I would be. And he started walking in his neighborhood. Just, it made him think about that. And then he started to find the stairwell, which is, we call it Jacob's Ladder. It's about a 5-story, he said it's 200 and something steps. He now does that every day, 10 times a day. Every day, he calls it mountaineering. He has lost weight. He is managing his diabetes. So there are knock-on effects from actually doing these exercise program, that it stimulates, and that's the idea, is stimulates people to think that they can still keep moving and grooving, and that it's important. My father turns 80 next year, so it's an amazing story that I'm very happy about. So you can actually see our results on our website. There's our beautiful research report is laid out there that has our results. So please, if you're interested, have a look at that. We also did a separate report for that ACC that funded the research, just so that they could get some specific information from our kaumātua on how to better engage with our communities. So now that didn't end in the research. We could never stop there. Because ACC had looked for that, we really pressed ACC to continue funding this solution. They were looking for the solution, and we went from 9 organisations doing Tōriti to now we have 26 organisations throughout the country doing weekly practice exercise, Tōriti weekly exercise and food time in the Māori tribal organisations. So very importantly, we have kept the organisational stuff in the runanga, and we have applied for other funding to keep it going. It is very, very hard. I'm not going to lie, it's our strongest thing now, but we have to advocate for this really positive solution, because we don't want to just do research for the sake of doing research. We need to have it in action. And so that's why we're driving forward. We've created a charitable company that sits in the runanga, so it keeps it Māori centric, keeps it Indigenous centric. That keeps the trust, our relationships in the communities are much easier to do that through the tribal organisation. And our chairperson is Moana Wesley, who's the centre of our practice. And that's Moana right there. And then, of course, Edward Allison is on the board, and we have other members across. So we've continued doing research too. I just want to say that we have been looking, did some research in our lab at the physiotherapy school with our elders. We had experts in Modako, which is one of the practices that they do. We set them all up with EMG and movement analysis, and here they are in the lab. So hopefully, unfortunately, you get to hear my terrible voice. I would love to bring that volume down because I hate my voice. So you can see we had our expert on a video and our kaumātua doing the exercises. Now here is our 80-year-old Ron, and I have got permission for us to show this because he's so proud of it. They all are so proud of being involved in this research. And again, we found positive, of course, EMG findings. So the muscles for falls prevention were really stimulated with that. We did it at different speeds. So we're looking at actually implementing this practice as well in Tauriti too, or as an adjunct as well. It would be a similar practice to Tai Chi. So Tauriti 2 meets all of our health plan priorities in New Zealand. Our health plan is called Te Paitata. So many of our things have a Māori word for our policies. So Te Paitata is the national health policy, and Tauriti 2 meets all of those priorities. It again, of course, meets all those criteria that I talked about that are necessary for an effective community strength balance class. And the additional one specifically for our Māori communities is to have it through Māori organisations. So that is a criterion that I would add to that. If we're going to drive these, they need to be through Māori organised or Indigenous organisations. So I just wanted to say that it meets all of the ACC standards as well. And my last comment, hopefully it's my last comment, is the keys to having this impact is in getting the translation of research quickly into action is that you, for us, was the Māori organisations drove owned the research, so they drove it. Māori organisations or Indigenous organisations have a very strong idea of responsibility to make a difference for their people. So they are going to make sure that whatever solutions you find makes a difference. It has to have positive change. So it has to be engaging for our communities. Having it through Māori communities where they have the compassion and care for the communities and relationships and trust. Using those Indigenous research philosophies, really one of the key things is that it has to end in positive change for the people that are involved in the research. That's really important, and that the ownership of the research sits with Māori or with Indigenous people, because they're going to make sure that it actually has positive change, and it empowers those community members to be involved in research. So here is just a glimpse. Thank you for your time. I want to say also we are about to have our first inaugural kaumātua or Elder Olympics for Tauriti 2 in November. It's crazy that I'm over here right now because there's so much organisation for that. We have kaumātua from all of our 26 communities across the country, you know, some coming as far from the far north of our country down, and they're all staying in all staying together. It's going to be fantastic, but boy, I've got a lot of work to do when I get home. Anyway, I'm going to stop my share, and hopefully I've allowed for time. I hope that was engaging. Are there any questions? I have something in the chat there. Is there?
I think that was just somebody who just needed to leave.
Getting out.
There. Are there any questions for Archie's got her hand up?
I see you, Archie. Are you okay? I'm sorry, I should have asked you if that was okay to put your photo there.
It's fine. I love my picture.
Yay! I love that photo.
Thank you so much, Katrina. You are an inspiration for sure, and you've done so much with your community. It's quite mind-blowing. And as somebody, you know, who is of the vintage that should be part of your study. I'd love to come to New Zealand and do it, but whatever. I did have a little picky question here.
Sure.
And it had to do with the graph that you showed where you showed the costs of falls. And it struck me that it had been increasing over time.
Yes.
And what's the reason for that?
Well, we're an aging population.
Yeah, that's what I thought.
Aging population, and this is happening, you know. So falls for in New Zealand cost $1 billion last year in total, which is the biggest. It's more than sports injuries. It's more than work injuries. Believe it or not, even paying for people off work. Falls. There needs to be more work in falls. I'm telling you, it's a big issue, and probably even bigger than what. Because there's some people that do not, they're too embarrassed, or they don't apply. So, you know, costs for falls, it's huge.
It's huge.
Yeah.
Thank you.
Yeah.
Thanks, Katrina. Sarah, did you want to come in?
Yeah, thank you. Katrina, for your program, Tauriti 2, do the participants have to pay for it, or is?
No, that's why the other thing is we really want to make this, like, remove all the barriers. Yeah, so some have said they'd like to, but I don't want to open that up because it makes the ones who can't afford feel a bit shy. So boy, I'm telling you, we're going to press this very small amount of money is going to make such a considerable difference, and not just in falls, so many other avenues. So, you know, this can be useful for, we have people with Parkinson's, we have people that are blind, we have head injuries, we have, you know, people with COPD and diabetes, and we have people with all of those things, you know, so that are coming. And so we don't need to have separate classes. They're getting some of it. We do need to, if it's cardiovascular, we do need to have a little bit more, we understand. But if we can engage them at least in something that's useful and enticing and fun, that's always good. Yeah. So no payment. Sorry, that was a long answer to that question.
It's an important one. It's a very important one.
Yeah.
It says Priscilla Flat. There you go.
Hello.
Hello.
Hi, my name is Priscilla Flynn, an Indigenous physiotherapist in Canada. And I just had one question.
I want to meet you. Where are you?
I want to meet you as well. I just got an email from Ray saying that I would love to meet you. I did have one.
I think I saw an email of you, a video of you online.
Oh gosh.
Giving a presentation.
Oh
so
no.
I've already looked you up, but can we connect anyway?
I had one question, and you might have mentioned it. Who are you training in the communities to provide this?
Oh, good question. They're largely the people, some of they work for the organizations largely. So they may be running programs. They don't have to be a physio, but we do make sure there's a physiotherapist attached to all of the programs. That is important, so that they are, you know, some are physios. We do have about 5 of the programs are run by physios, which is fantastic because it's also this way that our Indigenous physios can thrive. They love it. They're like, oh, finally, I feel at home. It feels like something that really connects to me and being able to provide care. So, of course, I've got a little bit of a bias towards our physios. I think they do a great job, but you don't have to be a physio. So most of them are workers within those organizations that tend to have, you know, a drive towards physical activity. But it's really important that it's people that connect with the community. That's the most important. And that's not always the physios, unfortunately. Yeah, so, you know, even if it's a struggle to always get Indigenous physios connected to the, some of them are non-Indigenous, but we do drive to try and have that. So, yes. Does that answer your question?
Yes, it did. Thank you very much.
Thank you. And please, can you connect? Where are you situated?
I'm at my office for today at Waverley McGillivray, but then we have a conference with our work Thursday and Friday.
Okay.
But I would love to meet once before you leave.
Yeah, that would be fantastic. So hopefully we can connect. Thank you.
That's wonderful. One more minute. Is there anybody else that wants to sneak in a question? There's some thanks in the chat for you there, Katrina.
Thank you.
You want to take a look there from Corey?
You.
But thank you all, just respecting everybody's time and your time, because I know your schedule is packed. Thank you so much for today, Katrina. It was wonderful to hear about your programs. And I actually have to say, what I would really like to see is the videos and the photos from the Olympics. I am just dying to see those when they come out, because that
we have so much
so fantastic.
It's going to be amazing.
I can't wait. I hope you send those to us, because I
will
know that
probably be a small blob of Katrina-ness afterwards. It's going to be a lot of work, but I'm so excited. I can't wait.
It sounds wonderful. And thank you so much for your presentation. And just for the rest of the people who are there are a few more to come. I think there's a student presentation on Tuesday that they would like faculty to attend where they can, please.
Please.
So thank you so much for your time today.
Thanks,
everyone.
Natalie.
Have a lovely day.
Tēnā koutou katoa, ka mihi nui nui. Ka kite.